ka o qala mo kula wa ka ke kutse ka 2000 ke kutlwa re ke kula ke hloka le matla ke taba le mnana re ke tswe ke gase ke ha mema Mokwena ho tswe ngwa ka o ya mema Mokwena mo ke fihla ke kena ka mokhukhu fihla ke dula ka disofe ke fihla ke ithaballa mo mema Mokwena ha kena ka mokhukhu mo fihla antola ke le ka mono fela ka re mema Mokwena ke lapile ka ke robala bona ba fihle ho mema Mokwena ba nkile dipidisi ba fihla ba re ke hana ho nwa dipidisi ke a lore mema Mokwena o botsa potso re na motho a hana ho nwa dipidisi tjena na o jele afo jwanna ba re o je re tsele ke mo ratetse hore ke atla le bona hone a mpotsa hore na hobaneng ha ke hana ho nwa treatment na ka ke ntse la mema Mokwena ke lwana o le tjena o ke kwa ba nwa treatment o sa ja mema Mokwena ke ansa diba
ka qala ho ithaopa ka bona hona le setla batho ba sotlang mona Meloding Virginia ka fumana hore ba dia ho fitlhella clinic mpho ke fihla ho yena o se eleng morning ka bo 8 hantle ha ke fihla ke mo dumedisa ke a kokota ke mo dumedisa ka ta mo dumedisa ke mo tsa bophela and then ka ta mo ke mo fa metsi a hlabe before o tlamile a hlabe pele ha ka ta o hlapa mpho ka ta ke mo fa dijo ha ka ta ho ja and then ya ka ta ke mo fa treatment ka mora treatment ke qale ke tlhotlhore bethe ya hae ke clean bethe ya ka to clean bethe wa bala mo ke a bo massage ke mo sa mo ke mo ka ta ho massage ha le shapo ke mo yetse ke re mpho se ke ile ke lo etsa dijo tse ding tsa motshehare
le montsena tse 16 tsena tse mema Mokwena na mtsa le supervisor gabe lore a ke yo le nna lefatshe o latela yena o ba teng wa hae ke tla o thibile bophelo ba ka bo le hole
mpho ke tena ke mothusa kana bane ke le kgoba le ntse ke rata le ba ka la ka khobane ha ke ba tlo bona motho a sotlele kapa motho a kula a sa fumane thuso.
A community healthcare worker is somebody that works and serves in the community that they live in. These are people that assist people in vulnerable communities, the poorest of the poor, in terms of accessing healthcare services. Community healthcare workers are at the forefront of primary healthcare in South Africa because there's an issue of affordability for transport to get to hospitals. There's the issue of distance. Community healthcare workers plays that role to bridge that particular gap. The CHW stipend ranges from anything from 800 to 4,000 rands. Most of the community healthcare workers are women. Some of them are breadwinners within their homes, and some of them are single-parent households, and they use this money to pay for school fees for their children to go to school, buy uniforms, buy food within their homes, and clearly that's not enough. If it was not for the community healthcare workers, it would be a dire situation. This country would be facing a major dire situation. Currently it is, but by God it would be worse off without community healthcare workers.
For me, to be a community health worker, it's not about money or everything. It's about the love of my people, love of my community, seeing my community suffering, and also the call by our government to say they need help. I've been a community health worker for the past 10 years. We started getting 1,000 rands a month. Then it went to 1.5 in 2010. Then 2012, we had to toy as community health workers to say what you're giving us, it's too little, until we agreed for them to increase our stipend with 1,000 rands. So now I'm currently getting 2,500 rands. We are breadwinners at home, supporting, like me, I'm supporting 5 people. 4 plus me, it's 5. And my transport fee to work, it's 700 rands a month. And my granddaughter, it's 450 a month to go to school. The one who's at the child care, it's 300 rands every month. And also I have to buy food, go to work and eat at work. At the end of the day, I end up with nothing. All the money is spent on the transportation and also taking care of my family. You go and do your work wholeheartedly with all the love and passion. At the end of the day, you are not recognized. Most of us community health workers, we've been trained, so we are going nowhere with that training. So with that skills and everything, if the government doesn't not recognize us, who is going to recognize the community health workers after doing such a great job for them?
So the ward-based outreach team policy is really trying to reorganize, formalize and standardize a very large infrastructure of lay and community work that emerged around HIV and TB. And it became clear that with time, the health service was completely dependent on these workers. The HIV program cannot run without a small army of lay health workers who actually effectively the glue holding this program together. If community health workers are to provide an 8-hour day, 5 days a week, they need to be appropriately remunerated. That is a key issue that has to be addressed, and at the moment it's not. It's a threadbare, underfunded infrastructure that cannot make a serious difference while it's in that state.
In 2014, the MEC of Health in the Free State, Benny Malakwane, dismissed all 3,800 community healthcare workers because he felt that their services were no longer needed. After several attempts to try and meet with the MEC, community healthcare workers went to Bophelo House and demanded to meet with the MEC. Unfortunately, the MEC didn't avail himself, but the HOD, Dr. Mtau, availed himself and promised them that they will get back to them in 7 days. After 7 days of no response from the MEC, community healthcare workers decided to go and hold a night vigil outside Bophelo House.
I don't know why I was fired for being a community healthcare worker. We only received the letter that told us that on this date, you must stop working. We don't know why we were fired.
Oh, it was a cold night and a rainy night. The police came and said why we were in Bophelo House at that time. We explained to the police that we couldn't find the MEC during the day, so that is why we were there at night, so that the MEC, when he comes in the morning, we can see the MEC and go to talk to the MEC. Because each and every time when we went there, even if the MEC is there, the secretary will say the MEC is not there.
We ended up outside his office, gathering peacefully without any harm. We never had any weapons in our hands, just there waiting for our boss.
We told the police that move from this place because we are here to see Benny Malakwane. And they told us that people who are over 10 at the same place, that is against the law. And they say, we are going to arrest you. We say, okay, you can arrest us if it is against the law.
We just get in there, in their trucks, peacefully. Even them, they were very surprised. How can these people volunteer to be arrested?
Eventually, they came with another load of the vans and put us in jail. I don't know why I was arrested. I was just singing. I was not fighting with anyone. I was just sitting down and singing.
The number that was counted there, it was 130 community health workers who were arrested.
I won't stop fighting up until we get our jobs back.
94 community healthcare workers were arrested for holding a prohibited gathering outside the Bophelo House. They were convicted and they were found guilty. And the man behind this, Free State MEC, Mr. Benny Malakwana, who sent these community healthcare workers to jail for holding this peaceful gathering outside the Bophelo house. But the legal representative is fairly confident that they could get the judgment overturned. There are 72,000 community healthcare workers in South Africa, and yet we don't have a national policy that guides them. Our asks are simple. Firstly, we want government to finalize the draft policy on community healthcare workers so that provinces know what to do with them. Secondly, we are asking that Treasury makes funds available for at least the 72,000 community healthcare workers so that they can get on with their jobs. This is not rocket science. The future of South Africa's HIV and TB response depends on this.